Thank you. Well, good afternoon, everyone. Yeah, this is our HVA. This is an example, a final version of what we came up with. And we actually did it in a three-step process. One of the first things that we did is, as a hospital, we have an emergency operations planning committee. And what I did is I randomly pulled out of a hat, literally pulled it out of a hat, 4 names out of that hat, and we all sat down, and that's how we started our process. And what we did is we actually looked through a lot of different information. We looked at crime statistics, we looked at things that went on in the hospital, and that's where we started. And we broke it down into 4 different areas. We had technological events, which is the first one up here, and we'll talk about that one here in a minute. Then we went into naturally occurring events, things like tornadoes, hurricanes, all those kind of things. And believe it or not, our system, I belong to CHS, they have a big problem with hurricanes in some of their locations. So we had to modify some of them to make it fit our region. Then we went into human-related events, human error type things. And then we went into events involving hazardous materials and those kind of things, MCIs, mass casualties, those kind of things. But one of the first things we looked at is one of the guys that happened to be on my team this year was an IT guy. And man, did he provide some information for us that we didn't know about. And so when we started going through the process, he talked about the risk to cyber. Believe it or not, every day your guys' hospitals are being targeted one way or another. And so, and that includes your smartphones, it's all different kind of things. So we looked at that, and we ended up ranking that a little bit higher, especially now with, there's this thing where they are holding captive medical records and those kind of things. One of our hospitals in our system did get hacked with that. So I'm not sure what they call it, but they held those records for ransom. And so we ended up putting it up there. But one of the big things that we found is on the external response is there is not a big IT market in Spokane, and you cannot go out and just buy parts if something were to go down. You would have to get them FedExed in, something like that. So the response is pretty minimal for the city of Spokane on what they can. I mean, they have some stuff, but they don't have a lot of stuff. So we looked at those kind of things. And when we talk about like communication failures, that's phones, those kind of things. So we started talking about all these different areas, and we went through, and we just, as a group, we just a best educated guess by looking at different things that we came up with. So on this first page, on the technological events, the information systems failure ended up being our #1, and that's what our focus will be. We're actually getting ready to do a drill where we drop all their IT and see how the nurses react, and we're not even telling them. So because they're supposed to have, Daryl talked about the downtime. You're supposed to have downtime forms and those kind of things printed out and be readily available, and we're going to try that and see what happens, and make sure that they're aware of those kind of things. So what we're going to use our HVA for is planning some of these events, and I'll move to the next page. And so again, we get into the naturally occurring events. We looked at what did happen in our region or what potentially could happen. And we looked at all these different things. And you will notice like hurricane, tidal wave, dam inundation. We sit up on a hill just like Providence, Sacred Heart. So there's really not going to be dam inundation up that high. It's not going to happen. So we ranked it all zeros across the board. We just kept it there because my corporate office makes us put these on there. I would prefer to take it off, but they asked me to keep it on. So we looked at the wildfires. We all have had those kind of things. But one of the other things that we did do this year is after we got done with our little committee going through all 4 pages, all these different things that we looked at, is we brought in the police department, we brought in the fire department, we brought in the healthcare coalition and the health district. They were represented by Susan Soberg, brought her in. And then we also brought in the Greater Spokane Emergency Management. Lisa Jameson came in, and we did a lunch, and they went through this with us. And let me tell you, there was some things that are still shocking to me. Like, how many SWAT officers full-time does the city of Spokane have? Anybody tell me? They have one. Everybody else is volunteers, and they are spread out throughout the whole city. So what they would have to do is, if there was a hostage situation, something like that, that required SWAT, they would call in the team. All right, it takes time for them to get there. They would have to drive out to Phelps Field, where they position all their stuff, and then they would come into your location, wherever that is. All right, the same thing with the bomb squad. All right, our bomb squad is a conglomerate of, we have the military base, we have city of Spokane, we have the state patrol, which leads the bomb squad, and then we also have some of the local sheriff's department and those kind of things that are part of the bomb squad. And one of the things they talked about was, this was an actual event that happened. There was a football game going on down in Pullman, and there was an event that occurred down there. So they drove down there with their team. All of a sudden, up in Spokane, there was another event. There is only one regional team for our region, which goes from the Canadian border down to the Oregon border. And so what they ended up doing was breaking off that team, splitting that 8-man team into a team of 4, and the other team drove back up to Spokane. So if you guys are thinking that you're going to get a quick response from some of those things going on, it's not going to happen. And we were wondering why it took 2 to 3 hours to get a bomb squad when we had a suspicious package at the hospital. You know, so we looked at all those. They looked it over, and they did do a great job of going over. The police department talked about different things that were going on, gave us kind of a local briefing that was going on, and that actually changed some of our things. And I believe it's on the next slide. And I'll just have to go down because I don't have a clicker. Yeah, our active shooter, we had it ranked kind of low, just because yes, it happens, but it doesn't happen a lot and those kind of things. But they were talking about, he gave us more statistics about different things that happen with those active shooters and what they're out for. So that actually bumped us up. And as soon as I'm done today, I'm actually leaving because I have a meeting with the Spokane Police Department and the Greater Spokane Emergency Management. They're coming in, and we're actually going to do a live drill in the hospital with active shooters. And we're actually setting that up today. I had that scheduled before today, so it's one of those things. But we use our HVA to prepare ourselves for what's going forward. So, and this is the Kaiser model that Daryl put out there. Basically, it just puts your percentage of what's going to be your greatest risk. And for us, active shooter ended up being number 1 because Deaconess has had 2 in the last 5 years, as what you guys are all well aware. You know, I wasn't there when it happened. I've only been there about 1.5 years. I know Adam was there, and it was pretty scary, from what I understand. I mean, I've been shot at, but not in that position. So, so when we did this, after we got done talking to the police department, our little committee met back and redid it, and then we took it to our full Environment of Care Committee, which is kind of a safety committee for the hospital. And we sat and we actually had another 1.5 hour discussion. It was pretty much the whole meeting about the HVA. And then they get to vote on it if they have any questions, those kind of things. So in the hospital, we use this to do our drills. This is what we're going to drill. What is high ranking, those kind of things, whatever ranked the highest 3, we're going to focus our training around that for the year. And sometimes it's going to be the same thing from year to year. When I worked at Providence up in Alaska, our number 1 threat was snow, believe it or not, in Alaska, go figure. But that was our number 1 threat. And so every year we did things around cold weather, snowing, those kind of different kinds of blizzards and those type things. Here it's a little different. It changed from last year to this year, and that's going to happen based on what is going on in the community, what actually has happened in the community. So that's kind of how we did it, is we put together a group. And my group, I had an IT guy, I had a clinical guy, I had myself, Then I actually had a registrar that was in there. And then we did bring in one person from the administration, and it wasn't Devin. Devin didn't sit in. I purposely didn't bring him in on that. I brought another one that wanted to get some experience. And so I brought another administrator in to help us go through the process. And I mean, we all sat, and it must have taken us, I would say, about 2 to 3 hours to go through all this with all the cussing and discussing that was going on. So, and there were disagreements, I'll be honest, and there will be disagreements because things that I think are important, a nurse or a clinical person may not think are important. Things that a clinician thinks are important may not be important to a plant ops guy or something like that. So you have to take that balance, and you have to be willing to listen to another side of the point. You know, and I think one of our biggest discussions was over whether or not tornadoes was more important than a volcano. I mean, you guys think that doesn't happen, but you know, when I lived here in 2001 on the base, we actually had a tornado that touched down on the base. So I actually was in Hawaii. My mom and dad called and said, "Hey, what is this sound?" And it was the base sirens going off, and they were taking care of my kids, so they had fun. I was still sitting on the beach. So, but it's one of those things that happens, you know. So there are going to be active discussions. You just work through the process and work through it. And basically, when we looked at assigning our numbers, we looked at like the human impact, whether it was going to be high, and we looked, and you know, we came up with some of our definitions. Like high impact would be, I don't want to say death, but death or bad injury, those kind of things. Physical losses was, and one thing we had to keep them, reminding them, was that this was about the hospital. All right, it wasn't about the surrounding community or any of that. We were focused just on the hospital itself, and it is to the institution. And I think that's important to remember too, that it's to the institution. And then when you think about the interruption of services, you look at, see what happens with the clinical side. Can doctors see patients? Are patients going to be harmed? Those kind of things. So you have to look at those. You look at it a little bit different. And then you go into pre-planning and those different kinds of things. And you just, we did go through and we identified what our definitions were before, so that everybody was working on the same definitions as we went through. So, and it was a group, we came to a consensus on every single one, and then we just moved on. So that was our process. If there's any questions, I will tell you, bringing in the police and fire department and the health district and all that is very, very important, because they are going to tell you things that you wouldn't normally think about, you know, like the delay and wait times and those kind of things that are occurring. So any questions on that?